Hi, everyone. Hello and welcome to the Flint Community Webinar, your community resource. I want to start today by giving you all a quote from one of my favorite writers. Her name is Tressie Cottom. She was talking about the history of one of the great community organizations, the Black Panther Party. And she said, there is no greater religious tradition or commonality across all people, across the world, and across time and space than the idea of loving people and serving them. And she was talking about one of the tenets of the Black Panther Party, and she said, you take neither needle nor thread from the people. Today, I am grateful for the opportunity that we've had to work with community and to talk about a topic that was identified by community. And we have the honor of doing this on what is our 156th webinar, where we've had the opportunity over time and space to talk about things like the coronavirus pandemic and things like pediatric vaccinations. And so today we're going to talk about a topic that is really near and dear to community and was brought to us by community. And we're going to talk a little bit about cancer incidents by virtue of the Flint Community Cancer Consortium, FC3. I'm so thankful to have had the opportunity to be a part of it. All right, we've got a lot of wonderful people today who are going to talk and give their expertise and their experience and just share with us what they've learned and how we came to create this opportunity. And we're going to talk about assessing unusual cancer patterns in Flint. I think we're going to start off with one of my very, very, very favorite people. The wonderful Art Woodson is going to talk to us a little bit about how we got here. You're muted, friend.
I am so sorry. Normally, I'm not muted. I'll be talking so much. I'm sorry. Thank you, Dr. Johnson, and thank everyone for coming on to the webinar. It has been a magnificent journey. It's been obstacles, but being with Dr. Lee, Dr. Johnson, Dr. Heatherland, and Dr. Justin, and it's just amazing and beautiful how I'm in a room with all these doctors, and they took this to a whole nother level, and this feels great being able to do this feasibility study because we have a serious issue here in the city of Flint, and it needs to be addressed. And working with these wonderful doctors and community activists, community organizations is such a wonderful thing. And it just warms my heart just to know that we have doctors and community people who takes a lot of their time to help us, and just seeing the doctors help with the cancer incident report, which got us started, and giving the information that I couldn't read, and no one else that was in the room could really see what was there. And what we heard, how we got started is what we heard was community raised the alarm about increased and aggressive cancers. What we did, we contacted local leaders, researchers, news media, and others. And from there, what happened, FC3 was formed to bring community leaders and residents and organizations and researchers together. And this is such a wonderful thing. We are blessed here in Flint, and this is community driven. Also, is a feasibility study that is community driven, and NMQF. I think Miss Katie Chavez, you are up next.
Thank you, Arthur. Sorry, everyone. I'm trying to get my camera to turn on and it's not cooperating. Okay, I think I got it on now. All righty. Yes. Thank you everyone for being patient with me. So I am Katie Chavez, and I'm with the National Minority Quality Forum. And I just wanted to speak a little bit about NMQF's background and what my role has been with this project, just to get everyone oriented. So the National Minority Quality Forum was founded in 1998, and we have a simple but very urgent mission, which is to reduce patient risk and advance health equity by ensuring optimal care for all. And so we use data to drive action in communities and to achieve meaningful change. And our work in Flint began really with just listening. So before launching any programs or getting involved, NMQF conducted a series of listening sessions with Flint residents. And these were honest and community-centered conversations, really designed to help us understand the lived experiences of the community of Flint. And so we heard directly about the long-term impact of the water crisis, of the community's concerns about rising cancer rates, and additionally, just the fatigue that the residents have felt from previous research, where researchers come in and collect data, but we're left without seeing any real change or support. So in 2023, we were awarded a grant from the Michigan Department of Health and Human Services to lead a project to conduct a feasibility assessment for an epidemiological cancer study in Flint, which I know shortly Dr. Heatherlyn is going to be diving into a little bit more as far as what that means and how it's done. So our MDHHS funded work is focused on really building the infrastructure, evaluating data collection systems, and engaging the community with the end goal of determining whether it's feasible to conduct an epidemiological cancer study and involving the community in shaping what that future study could look like. And so leading that effort, NMQF has awarded a grant to MSU and to the FC3, really because we saw a lot of strengths that the academic and community partnership coalition comes with. So they have an extensive experience and presence in Flint. They have the dedicated research infrastructure and a wonderful team that has deep expertise in public health and epidemiology and community-based research. So yeah, so I know I'm going to pass it over to Dr. Heatherlyn, who can talk a little bit more about the work that we're doing.
I will absolutely take that baton. We are so excited to be able to come to you, to the community, and talk about our project. The title is Community Academic Feasibility Study to Assess Unusual Cancer Patterns in Flint, Michigan. Long title with two very simple priorities. So we know that the community already sees and feels the burden of cancer. Maybe it's personal, or a family member, or a friend, or neighbors, or others, but there is weight to those experiences and those stories. What this study is helping us to do is to document those concerns with data so that what residents are seeing and feeling can actually lead to real action and change. Our first commitment is to engage and communicate with the community, to gather concerns about cancer, environmental contamination, the water crisis, and to keep residents involved and informed at every step of the way. And this town hall, or this webinar rather, is a part of that. Our second commitment is to make sure the work is done carefully, that the work is done responsibly and grounded in not only solid science, but is shaped by our community partners and building on the resources that we already have in the community. But an important part of shaping that work comes from our community feasibility panel. You probably got a look at that flyer. I do not think that we could have added one more face. Although we didn't capture all of the folks that are a part of the feasibility study, we did our very best to add those. So next, I'm going to invite members of our feasibility panel to turn on their cameras. I'll stop sharing slides. And I'll call on you to just provide your name, your organization, and briefly, why is the project important to you? Just stop here. So You can see everyone's faces now. We've got a whole lineup of folks. I'm going to start, and we'll do our best here. I'm going to start with Doc G. If you don't mind just introducing yourself.
Hi, I'm Dr. LaTressa Gordon. I'm Director of Public Nursing with Michigan United. I also have been impacted with cancer as a young age. I lost my father. I work with American Cancer Society and ambassador for Voices for Women. So this is very important to me. It's personal and also rooted in our community. And I will pass it over back to you, Heather.
All right, I'll grab and go on my screen right above you to Dr. Bailey.
Good afternoon, everyone. I'm Reverend Dr. Sarah Bailey, and cancer is personal to me as a survivor. Also, I have a child who survived childhood cancer. It has been prevalent in my family for quite some time, and I'm sure it's due to some of the environment here in Flint. I am the CEO of Bridges into the Future. I'm also the co-lead for CE at the Michigan Institute for Clinical Health and Research. I am the administrator of the Flint Public Health Youth Academy, which has taken a front row seat to this study. And I'm also a board member of community-based organization partners, along with several other organizations that I'm a member of. Thank you.
Yes, but put a pin in that youth project, because we're going to come around at the end of our presentation. We'll talk about that because that's an important part. EJ, you're just above her in my screen. So why is this important to you?
I told you when I started, the honor and privilege to be able to serve community is where my heart is. It's part of the reason I'm a physician. It's part of the reason I do any of this work. And so to get to be in community with each of you is my greatest joy. So
yeah. And then we have Jim Milanowski.
Well, good afternoon, everyone. I'm Jim Milanowski, President and CEO of the Genesee Health Plan. And we know cancer is prevalent here in our community. We see the claims. We know people that have Genesee Health Plan get cancer. And not only looking at it from a business perspective, how much it costs our healthcare system, but looking at it per person, how the cost on them, and having to miss work for treatment, and the hardship on their families, and all of that. So this is very important work, and glad to be part of it.
Thanks.
Thanks, Jim.
On our Brady Bunch squares, I've got Katie right behind. I know you just spoke, Katie, but something you want to add?
I guess personally for me, right? And sorry, because my camera it's on the fritz. It goes in and out. I keep trying to turn it on. But it's just I come from a background of programs in community, and I know how important it really is to center the community voice at everything. So when I came onto this project, that was really what drew me to it, is that it wasn't just another research project. It's a sense of community. It's a sense of doing this together collectively. So yeah, that's what brought me to it.
Yeah, thanks. Lee.
Thanks so much, Heather Lynn. My name is Lee Pierce. I'm a professor of epidemiology at the University of Michigan, and my main area of research is women's cancers, primarily ovarian cancer. And this is a very personal journey for me, being a cancer epidemiologist. I lost my mom when she was 63 years young to cancer, and my grandfather when he was 62 years young. So this is a lifelong interest and passion for me.
Nicole.
Hi, everyone. My name is Nicole Smith Anderson. I am with the Greater Flint Health Coalition, and we're obviously interested and engaged in this party because the Health Coalition does a ton of work around health education and patient navigation, really always looking to improve health outcomes for our communities. So we are very grateful to be a part of this project.
And Athena.
Good afternoon, everyone. My name is Athena McKay. I have the opportunity to serve as Executive Director of Flint Innovative Solutions, also the Program Manager at the Michigan Institute for Clinical Health and Research at the University of Michigan, Ann Arbor, and the Deputy Executive Director at the Community-Based Organization Partners, better known as CBOP. And I'm going to add this as my connection with Mr. Woodson. I have the opportunity to co-lead the communication group, which meets Thursdays, every other Thursdays, and has since the water crisis erupted. This work is important to me because, for one, as many of you know, Mr. Woodson has been in this journey for quite some time. And so I have the opportunity to be one of the many who hold his arms up and speak truth to power. I'm privileged to be in this space to have resources come to our community. And additionally, personally, my son is a cancer survivor. Through the water crisis, he had 3 tumors grow in his jawline and has had, I believe, 7 teeth removed. And so seeing a potential Olympic athlete go through that traumatic experience and still be able to get up every day to make an impact in the community is very precious. And we definitely need more resources all the way around. And so very, very thankful, Heather Lynn, for this opportunity.
These stories are personal, and this work is personal. Kenyetta.
Hello, everyone. My name is Kenyetta Dotson. I work at Michigan State University. I've been there for 8 years. I'm a mom. I'm a strong advocate in community. It's a blessing to be able to work in a place that aligns with what you feel your purpose and your calling and your assignments are. My reason for being a part of this specifically is in community, people are already dealing with so much. And then when you see trends, when you see people getting cancer at an alarming rate, young people where there's no respect of person, young people, middle-aged people, our elders in community, some of which go into remission, but unfortunately, a number also pass on. And when you have no explanation for that, I think it's important being community leaders, advocates, folks who are responsible for our most vulnerable and smallest citizens to try to be as solution-driven as possible. So we're here because we want to be informed. We want to make sure our community and those we love are informed, and that we're able to move forward as strong as we possibly can together. So thank you for being here. I'm glad to be a part of this team, and I'm so excited about what is yet to come.
Thank you for that. We'll go to Art. I know you've already shared a little bit. I'm not going to let you off the hook. You got to do it again, and then we'll finish up with Chanel.
Hello, everyone. My name is Arthur Woodson. Again, I am coming to thank everybody on this panel. Y'all just don't understand. All these beautiful, intelligent people on this panel, and when you hear them speak, it's everybody telling them their story of why they're participating. And mine is my aunt passed away from cancer, my cousin passed away from cancer, my friend Lori passed away from cancer, and my friend Pastella passed away from cancer. And it helped me to really push me to trying to find out what is going on here in the city of Flint. And I am so grateful and so thankful to God that I have all these wonderful people that I'm able to work with. And trust me, the community here in Flint, this is the most transparent group of people and honest, and you can hear it in their voices. This is personal. This isn't about money. It's not about fame. It's not about any of that. It's about helping and bringing resources to the city of Flint for the people who are affected with cancer. And I thank you all so much.
That is so well, who are affected and who will be affected in the future and don't know it yet. Absolutely. We'll go to Chanel, and then I see we've had one more member join us, Asia Donald. So then we'll have Asia introduce herself and why cancer is important, or why the project rather is important to her. So Chanel.
Well, good afternoon, everyone. My name is Chanel Dismond. I am a financial professional here in the community with over 30 years of experience, serving as Vice President, Community Manager with JP Morgan Chase. Also the founder of the Financial Empowerment Zone and founder of Navigating Cancer in the Community, a monthly community conversation that includes cancer patients, survivors, caregivers, organizations, and those who've been impacted in any form by the trauma that can be experienced through a cancer diagnosis. Being a part of this work means so much to me because I too am a cancer survivor of stage 3 colon cancer. And it means so much, the work that's being done to truly stand in the gap and advocate for the community, those who are impacted, and as Heatherlyn said, those who will be impacted, looking at what the root causes of those things are and trying to head them off before more people are traumatized by the loss of loved ones. As a cause of cancer. So it's a privilege and an honor to be a part of this group of individuals who take this work very seriously in standing up for those who need a voice, dispelling the myths and the fears and replacing it with education and advocacy. So thank you all for being here, and thank you for allowing me to be a part of this great work.
Absolutely. And Asia Donald.
Good afternoon, everybody. Can you guys hear me well?
Yeah.
My name is Asia Donald. I am a 22-year-old program coordinator for Flint Innovative Solutions. I also serve as a youth ambassador for the Flint Public Health Youth Academy. And this study is important to me because I personally feel like there are a lot of things that have come out of the Flint water crisis that we aren't able to measure at a surface level. And this is one of those things that we are able to measure and find a definite answer on. And I just feel like anything that we can get definitive answers for, we should get definitive answers for.
That's our youth friends, right from her mouth. That's our future right there. All right, thanks everyone. We're gonna turn back to our slides here. We've been talking about a feasibility study, but we haven't really talked about what that is. So what a feasibility study is the first step to determine two things. Can and should we do a larger study? And that larger study, you can see it's kind of long that we've written it out on the slides because we want it to be clear for everyone. Those larger studies are sometimes called either a cancer cluster study or an assessment of unusual cancer patterns. Because here's the thing, in each community, we expect to find a certain number of cancers because unfortunately, cancer affects many people. But a larger study, what this larger study is going to do is look for unusual patterns where certain types of cancers happen more often than we would expect in a group of people over time, or maybe the cancers behave in unexpected ways. But we can't jump to that, or we shouldn't jump to that larger study without first doing a couple of key things. We need to look at what data we already have, what information is available, and what resources exist. And on the flip side, we need to understand what we don't have, what's missing, what data is missing, what information do we need, and what resources are important that are lacking. Now, Lee is going to talk more about what that data involves and why it's important. But another piece to this feasibility study, or understanding could and should we move forward with a larger study, is to understand whether the community is interested in participating. We've heard from some folks who were concerned about sharing information about their cancer journey or sharing information about their health. And so as we gather this input, it helps us to together decide if and how we move forward with that next study and what it should look like. And data is a big part of that. And Lee is going to talk us through what the data looks like as we go through this feasibility study.
Thanks so much, Heather Lynn. What I wanted to just do is start off with a few definitions because we've heard already today a lot about rates and so on. So I just quickly run through some of the key epidemiologic terms that we think about. So the first is incidence, and that is just simply the count of new cancer cases in a given area over a given period of time. But then we want to study that in a different way by putting a denominator with it. And that's really what cumulative incidence is. And that's the number of individuals who become newly ill or develop cancer over the number of people who are at risk during that time. And so that's a lot of what we'll be talking about throughout the feasibility study. And then the mortality rate is the percent of the population who have passed away during a given time period. And then I think something that a lot of people don't know is that in every state, there is a cancer registry system, and that is able to be in place because in every state, cancer is reportable. So all cancers that occur in every state in the US have to, by law, be reported. And a big reason for that is so that we can understand the impact of cancer in a given community and changes over time. So for example, it's how we know that there are a number of cancers that are increasing in younger people, and that drives decisions about, for example, screening. It used to be that the recommendation was that we would screen for colon cancer starting at the age of 50, but now we do it at the age of 45. And it's because of this cancer registry system that's in place across the US that we're able to do that and to obtain data and understand what has been happening in Flint specifically over time. So what do we already know? The Michigan Department of Health and Human Services, or MDHHS, has done 2 reports looking at cancer trends in Flint. And when they've done that, they have picked certain cancers that have historically been known to either be linked to specific exposures, like trihalomethane, or exposures that are of interest to the community, like lead, or emerging exposures that we don't quite know what their impact on cancer might be, like PFAS. And in those reports, there was some suggestion of higher incidence, really cumulative incidence of lung, stomach, and prostate cancer compared to the rest of Michigan. But there was also a suggestion of lower incidence of other cancers like ovary, testes, and brain cancers. And at the end of the day, the reality is that those reports did not do everything that we would like to see done. So specifically, they didn't look at what we call hematologic or blood cancers. And we know this is a big concern for people in Flint. Cancers like leukemia or multiple myeloma. They weren't able to look at specific subtypes of cancer. And so when Dr. Heather Lynn mentioned looking at unusual patterns, that can include looking at whether certain types of cancer are more prevalent or incident in a community, or also looking at cancer outcomes. So I can tell you anecdotally, I've spoken with physicians working in the community who can say that qualitatively the cancers look different, and we're looking for ways to be able to quantify that. What does it mean for a cancer to look different? How can we measure aggressiveness, which is something that we think a lot about as cancer researchers. And then another issue is that in the work that MDHHS did, which was a great start, they weren't taking into account known risk factors for some cancers, like, for example, smoking patterns and adjusting the lung cancer incidence rates for that. And we know that that's something that we need to do. And it is something that through this work we will be able to do. So the other thing that we really want to take a deep look at is the age at onset of cancer. So we've heard a lot of passion, even just on this call, early discussions about pediatric cancers. So we want to try to understand that. We want to understand the impact of location. And this is one area where we will be able to really look at the smallest possible geolocation to understand whether there are hyperlocal cancer patterns in Flint based on the street that you live on, for example. And one main way that we're going to do this is looking at trends over time in Flint before the water crisis and after the water crisis, so we can look at that very important inflection point and compare to other regions across maybe the whole of the US and other regions in Michigan. And then, as I mentioned, we very much want to understand what we call the spatial clustering or the geographic location of cancer patterns. Now, one thing that I talked about earlier was this idea of cumulative incidence, the number of new cases in a community over the number of people who are at risk. And one of the issues that is a key factor in our feasibility assessment is how we are able to identify and track individuals who lived in Flint during the water crisis, but have since moved out of the community. And we want to make sure that we have a full picture of people who were at risk and exposed during the water crisis. So we are thinking a lot about how to do that so that our estimates are truly reflecting the experience of people who lived in Flint, particularly during the water crisis. And so I already mentioned about cancer registries. So in Michigan, we have the Michigan Cancer Surveillance Program, and they're really a dedicated group who receives reports from across the state. And they, for all intents and purposes, catalog that information and make it available to programs who want to assess needs. For example, for maybe a community needs more cancer navigation or expertise for a given cancer, but also for us, we'll be able to analyze those data in Michigan. And then nationwide, we have something called the SEER, or the Surveillance Epidemiology and End Results Program. And those are specific federally funded, they're funded by the National Cancer Institute, areas where data are in the same way as what's done for the Michigan Cancer Surveillance Program, collected across the US. And that also allows us to be able to compare against what is happening in other states. And much of those data are publicly available with sort of a small effort to gain access and to be able to analyze those data. So we'll have very good comparison groups for this project. So then what I've talked about so far is how we're going to know who had cancer. And so that is very well in place and has been for decades. But now we have to think about how do we understand environmental exposures. And so we want to understand drinking water contaminants. And we want to specifically understand PFAS, which are endocrine disrupting chemicals. So they affect the way hormones are communicating within our body, and they're often called forever chemicals. So we know that in the US, 99% of people have detectable PFAS in their blood. And we know that the biggest exposure to PFAS comes through water. And so we are interested in understanding PFAS. We also have to think about air quality and broader industrial pollution. There is emerging literature on the role of air quality and cancer risk. And it's not just what you might think like lung cancer, but also a very compelling emerging literature around breast cancer, for example. And so this is really on our radar as well. And then there are other soil and groundwater contamination that we're thinking about. And we have an amazing team of people who are able to map these exposures to given geographic areas. Next slide, thank you. So how do we do that? So the EGLE, which is the Michigan Department of Environmental, Great Lakes and Energy, I often describe them as the Michigan-based EPA, and they do air and water quality monitoring. They look at soil contamination. They look at Superfund and brownfield sites, which are heavily contaminated sites. They're also doing PFAS monitoring. And likewise, the EPA is also, so the U.S. Environmental Protection Agency, so our federal agency, is also measuring emissions by industrial plants. They're looking at air toxic exposures, and both in Michigan and through the EPA, there are also environmental justice tools that map a range of both community level factors and environmental level factors. And we can look at those cumulatively, or we can look at them individually to understand how they may be impacting the community and impacting disease risk. But then really importantly, we want to hear from the community is what are you experiencing? What are things that are kind of in place monitoring efforts aren't picking up? And that's what we want to hear from you. And you're going to hear from Chanel later about different ways where we hope to do that. So I did mention that one of the challenges that we will face is that we know that people who were living in Flint at the time of the water crisis have moved out. And there are ways that we can start to build what we would call the at-risk populations. So the population that was living in Flint at the time of the water crisis, because they that's the group that was exposed. And we can do that through some tools like LexisNexis, which is a commercial platform that basically aggregates data from public records. We can also look at voter registration over time. We can work with the Genesee Health Plan, our colleagues and friends on our community board, to understand claims data. And we're really working through other approaches too, to kind of build the historic cohort who was in Flint in 2014 to 2015. So then, in addition to defining who was living in Flint, as you all know much better than I do, it's important that we define Flint correctly. And although many people do this, we know that defining a community by their zip codes is not the right way to do that. And on this map on the right, we're showing in blue the zip codes that are defined as Flint, but then you can see the shaded green area is actually the city of Flint. And zip codes were made to make delivering mail easy, not to study disease or disease risk or impacted communities. And so we are well aware of the importance of properly defining Flint. And at the end of the day, we really also understand that a lot of environmental exposures are hyper-local. And we hear that from Art and other people on the community panel about specific streets or neighborhoods being affected. And so what we really want to do is define things in the smallest possible way, and then we can build out from there, but really using tools to look at, if not a specific address, but a block or a census group and so on. And so we are thinking very, very carefully about this. And so I think sort of to kind of sum all of this up, to really understand the connection between cancer and environmental exposures, we have to look in the right places and the right time periods. And this includes, as I just said, looking at neighborhoods, census blocks, water lines, to then compare the cancer data with the environmental data specifically of what was going into someone's house or where broader industrial sites are located, so that we're just taking into account location in a very true and honest way. And then also looking at time. And so we do have the inflection point of the Flint water crisis, and being able to look at what happened before and what's happened since. And we know that there is a time lag from when someone is exposed to when they develop cancer. And so, and we know that that differs by type of cancer. And so we are thinking about that. And now that we are about 10 years out from the exposure during the Flint water crisis, we can look at that critical time point and look at that critical window of exposure before and after.
Oh, thank you so much for sharing that expertise and your story. Oh, Heatherlyn, I was going to pass it off to you because I think I have you as next. But
yes, did we lose Lee?
No, I'm still here.
Okay.
Oh,
all right.
My apologies. I must have had tech difficulties on my end. It stopped, and so I think my audio went off. My apologies.
Well, hopefully it's not on my end. So I'll just say, just to wrap this up, to say that we are 100% committed to doing this with the utmost data privacy and doing it responsibly. And so we will be looking at group level data to understand the cancer rates and environmental factors that we can gain from publicly monitored data, and really deeply looking at where specific exposures have occurred. But I do want to assure everyone that we will follow the strictest privacy protections that there are. So I think now I can pass that back to you, Heatherlyn.
And I will. We all kind of held our breath for a second, because Lee's been talking about a whole lot about data, but we also recognize that community has expertise. It's the lived experience of our community members, which is so critical to this work. Folks who have lived through the water crisis, and folks who have faced a cancer diagnosis or have faced mourning the loss of a loved one is just as important as the data. So as we move forward with this study, we'll continue to include several ways to gather your input and feedback. I love the questions that we've already gotten in the Q&A. Thank you for participating. Chanel on the next slide is going to talk more about ways that you can be involved, but I do want to acknowledge that since starting this study, we have already done a couple of educational webinars. If you joined us in July, you learned about multiple myeloma, where we had a researcher physician come and talk to us about that. And it was wonderful to have community residents share their own experiences with getting tested for multiple myeloma and walking through that. We've also partnered with the Flint Public Health Youth Academy, which hopefully we'll be able to talk about in the Q&A session, where they did a digital storytelling project as a part of our FC3 project here. They were trained in how to capture those videos, and then we had Flint youth telling the stories of Flint residents' experiences with cancer and the water crisis. Those videos will be available on our website very soon, so you'll be able to watch those archived videos. Chanel is going to take us through our next steps, and then we'll go into Q&A.
Thank you, Heatherlyn. So as you've been fortunate to hear so much great information about the work that's taking place, the next steps would be for you to complete the FC3 community survey, because your input will guide future town halls, focus groups, and resources. Remember, your voice matters. This information is not just about the data, but it's representation of the voices in our community. Stay connected. Visit www.flintcancer.org and follow us on Facebook for updates, events, and opportunities. Again, remember, your voice matters, and we want you to stay connected, stay involved, and let your voice matter. Be involved, share this information with your networks, join us at an upcoming town hall. Your voice matters. I can't say that enough. Together, we can shape what happens next in Flint. As you see the QR code in the corner of the screen, scan that QR code to complete the survey. Thank you. And our upcoming town hall meeting, you'll see 2 dates at the bottom of your screen. Monday, November 10th from 5:30 p.m. to 7:30 p.m. at Michigan State University in Flint at 200 East 1st Street. And on Tuesday, November 18th, again from 5:30 p.m. to 7:30 p.m. at the Gloria Coles Flint Public Library at 1026 East Kersley Street in Flint. We look forward to seeing you there. Bring someone else out And again, your voice matters. We can't do this work without you. Heatherlyn, back to you. Oh,
All right. Oh, go ahead, EJ.
No. I'm not getting in the middle of anyone else today. I am not. Like, I am so glad I am amongst friends because I totally cut Lee off. And if she were someone else, she wouldn't know that I love her so dearly. We've got some wonderful questions in the chat, and Lee has already kind of taken the initiative to start thinking about answering some of these questions. Lee, I'm going to read the question. If you want to give the answer live, that would be amazing. I thought this was such a wonderful question when it came in because it dovetails with some of the work I do in the hospital. And I think it's a really important question. And it's this idea of if someone is deceased, but the cause of death was not listed as cancer, would they still be included in the data you receive regarding reportable cases for the purposes of grouping where they lived at the time of their diagnosis? And I think this gets at the idea that people can have cancer and die of a related cause. So maybe their cancer has made them more susceptible to infection and they die of the infection, but underlying cause was really the cancer. And so I will let Lee answer this question.
Thanks so much. So basically, anytime someone is diagnosed with cancer, that is reported to the Michigan Cancer Surveillance Program, regardless of whether they die from it or not. And so the answer to that is yes, absolutely. We will be able to include them.
Fantastic. And then I know we have another question. I wanted to talk a little bit about the Flint Public Health in the Youth Academy regarding digital storytelling. So if we could talk a little bit about that and what we're doing. And one of the things that I thought was so valuable about this was that we had people from Flint telling Flint stories and telling the stories of people who are from community and what their experiences are. So I'd love if either the wonderful Sarah Bailey or Asia would tell us a little bit about their experiences with that work.
Yeah, thank you very much. The Flint Public Health Youth Academy this past summer was able to, through support from this study group, provide digital storytelling to Flint residents who had already indicated that they experienced from the Flint water crisis cancer. The children that we had come in, and I want to express that some of them were teenagers and some of them were still children, ranging in age from 12 to 22. They were taught by Jamal Bransford, who is a two-time Emmy Award-winning photojournalist who came in and actually taught them the process of photojournalism and digital storytelling from beginning to end. And then the final piece to that was them actually interviewing some of the persons in regards to cancer, in regards to treatment of cancer, in regards to the community, and developing. And then the kids basically put those stories together to tell the story from their point of view. A lot of times what happens in the community is that we leave the voice of youth out. We don't think that youth are paying attention to some of these major issues, but we have found that we have youth within our community that not only understand what is going on, but they have developed opinions and want to be part of working towards solutions. Today, we have one of our ambassadors from the Flint Public Health Youth Academy who's a part of this this feasibility study committee so that we can have the voice of youth here. And they were able to, I think some of the people that got interviewed were very blown away by the types of questions that these youth developed on their own to ask about their journey into remission, in some folks not still in remission, but still dealing with going through the process of cancer. And they were very empathetic towards the people that they were interviewing, and they listened and they engaged with them. And I think it tells the story of the Flint youth from a whole different angle than what we actually see being told nationally or in news articles across the nation. Flint has beautiful children. They have beautiful teens, beautiful young people who really want to do something to help their community thrive and survive. If Asia would like to have something to say.
That was really beautiful. Thanks, Sarah. Aisha.
Just making sure you guys can hear me still.
Yes.
Okay. So we had a group of there was about 7 youth, counting myself, who were trained by Mr. Bransford, and interview skills. And what I'm going to start with this one because it really, really, like, these kids shocked me. We had two 12-year-olds. They came ready, like questions, like they knew of the people that they were interviewing, and they were engaged with those people. Not only were they ready to ask questions during their interview, you can tell how the answers are shaping their next question. And so I even saw some of the kids, and I'm like, where did you get that question from? Because you never told me that you had that question for this person. And they're like, well, Dr. Bailey told us to be active listeners, and this question made me have this question. I was like, okay, I like that one right there. You're doing a good job. But it was really impactful for me just to see the community engage with the young people and really feel comfortable to tell their stories. I know that for adults, it's hard to talk to young people. Like, I get it. Sometimes we might be kids and we not really listening to you, but it was very rewarding to see, one, the community show up for us and be willing to give their stories for us, but two, to recognize or to resonate with those stories. Even when I personally interviewed Mr. Woodson, and I personally know that he doesn't have cancer, but I know that he has some people that he loves who affect it. And even that interview for me was very, it was kind of heart-wrenching. Like, I had tears in my eyes, and I'm sure he had tears in his eyes, but it's conversation that's very needed. It's very stigmatized in the Black community, having these conversations, even among our family. Like, the first person that I ever knew who had cancer, I was 16 when I found out they had cancer, and they had it my whole life. And so it was just very refreshing to have a conversation with someone outside of my family, but productive to the health and wellness of their family as well.
I want to give such a thank you to the Reverend Dr. Sarah Bailey and Asia Donald for sharing their stories, their experiences, and for their work and time in doing this work. I know we have limited time, but I also want to shout out Chanel Desmond. I know you were one of the participants in this work, and if you wanted to say a few words about it, then I wanted to allow that for you. Thank you to everyone for your engagement. Art Woodson threw an Asia shout out in the chat. So Chanel, if you wanted to say anything, I wanted to give you that opportunity as a participant.
Oh, thank you. It is such a privilege and an honor to be a part of this work and to share my story and to encourage others to share their story, to come out of their shell and to know that they are not alone. That there are others who are, walking this journey, though every story is unique to the individual. But just to know that there's someone here to hold your hand, to know that there is such great work that's going on right around you to support you, to help get to the root cause or potentially get to the root cause of the cancer that you or a loved one may have or maybe will experience is so important. So I am so grateful to be here. Grateful for my life because again, beating stage 3 colon cancer, it was not discovered until it was stage 3. I had, no symptoms. So again, I can't emphasize enough how important it is that we listen to our bodies, that you speak with your physician, and if you don't feel like your questions are being answered or that your health is taking precedence when you walk into that office and visit that doctor, talk to someone else because your life matters, and we can't hear your voice if you're no longer here with us. So again, you are not alone. There are so many that are walking this journey and that are supporting you as you walk yours. So thank you.
Thank you to everyone. I didn't think I would be able to make it through this webinar without tearing up. Like I was pretty sure like it was gonna be over, and I appreciate so much the opportunity to be in community with you. I think there are so many takeaways, Chanel. The thing you just said, your life matters. And I think that's why we are all here. I appreciate so much the opportunity to bring everyone together and have this conversation. Thank you so much for all the work that everyone is doing. We have been live streaming on YouTube, so that will be an opportunity for you to see and share this information with your loved ones, your friends. This is not the end. This is the beginning of a long long time to have this conversation and lots of opportunities to have more discussion. I see Doc G put in the chat that we have a breast cancer walk that is 10/11 in the flat lot. Thank you again for all of your work and all of your community support. We appreciate you, and your life matters.